The top stories tonight in Y News. Senators agreed to tackle the prices of COVID-19 vaccines that the government wants to purchase only after the deals are finalized.
Manila Mayor Isko Moreno sees poor internet connection as one of the challenges in the city's vaccination rollout.
Travelers coming from countries covered by travel restrictions against the new COVID-19 variant must undergo fifth-day coronavirus testing. The Philippines' first known case of the UK COVID-19 variant is now cleared of coronavirus infection.
Children aged 10 to 14 years old will be allowed to go outside of their home starting February, but a research team advises the government to rethink the policy.
And U.S. President Joe Biden unveils a national strategy to deal with coronavirus, but warns it will take time to end the pandemic. Good evening, Philippines and the world. Today is Friday, January 22, 2021. I am Harleen Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. As part of our public service advocacy, being the nation's public service channel, UNTV aired in full the Senate hearing today on the National Vaccination Program. But we would also want to backtrack the highlights from the previous hearing. The role of tripartite agreements with the government in giving way for the local government units and the private sector. DOH to receive all vaccines upon arrival in Philippines for inspection. Government can still cancel vaccine purchase if recommended by Chinese experts panel, and using two different brands of COVID-19 vaccine to complete inoculation is not recommended, according to Dr. Lulu Bravo, the chairperson of the Philippine Medical Association's Ad Hoc Committee on Vaccination. Here are the highlights in today's third and final hearing. The Senate Committee of the Whole on the government's COVID-19 vaccination plan today, Vaccine czar Carlito Galvez Jr. assured that all negotiations and agreements are above board and free from corruption. He also vowed to divulge the vaccine prices once the negotiations with vaccine manufacturers are finalized.
We promise to reveal the exact prices and other details of our negotiations in due time as we firm up our agreements.
The senators agreed not to reveal through the hearing the exact prices of Chinese pharmaceutical firm Sinovac's vaccine while the negotiations are still ongoing. But Senate Minority Leader Franklin Drilon said it must be announced the moment the supply agreement is signed.
There is a commitment that since these are public funds, we reconfirm the position of the Senate President that he will be one with us in compelling the publication of the price after the supply agreement is signed with Sinovac for better public order.
Some lawmakers also asked for clarity about Sinovac vaccine due to its supposed lack of transparency and varying reports on efficacy rate. According to the Food and Drug Administration, one of the factors is the different target population in the clinical trials.
Yun pong sa Brazil, ginawa siya sa healthcare workers, pero yung sa Indonesia and yung sa Turkey, ginawa po sa general population. Meron din po akong napansin na konting pagkakaiba yung mga age group na kasama doon sa mga study per country. Factors like this can affect the efficacy rates and and the outcomes and the results of a study.
The committee invited Sinovac Biotech, but no one attended the hearing. Meanwhile, Health Secretary Francisco Duque III has called on the senators to legislate the indemnification fund for vaccinees who will suffer from adverse side effects. For now, the DOH says there will be a monitoring and referral system for those who will experience side effects. Senator Joel Villanueva suggested to study the creation of case rates for the treatment of vaccinees.
Ang PhilHealth po, ang sasagot naman kung may mga matinding side effects. Sana po wala, pero hindi po natin masabi dahil bago po itong bakunang ito. So anything is possible, but we will make sure that we will be very careful in the administration of these vaccines. So balanced billing is the objective.
Galvez also requested to senators to allow the local government units to make advance market payments for the procurement of vaccines and to exempt the vaccines from taxes. Senator Amy Marcos recently filed Senate Bill number 1988, which aims to exempt COVID-19 vaccines that will be procured by the LGUs and the private sector from import duties and fees. On the other hand, when asked by Senator Risa Hontiveros for an assurance that the purchase of vaccines from China will not affect the Philippines' claim in the West Philippine Sea, Galvez said they will not compromise the country's stake.
Every country wanted to help our global pandemic. So meaning ang po ng lahat ng mga countries, yung natin itatawag natin yung ating mga differences on the West Philippine Sea should be set aside because this is a global pandemic.
So I'm simply asking for a reassurance, Mr. President, Secretary, na hindi natin babawasan yung ating pagtaguyod ng national interest sa West Philippine Sea para dito, kahit dito sa usapin ng pagbili ng vaccine sa China. That's the only reassurance I'm seeking, Mr. President. Medyo na gulat ako dun sa sinabing set aside our differences in the West Philippine Sea. Hindi po yan na quid pro quo, Mr. President.
No, I would like to make a clarification. We will not compromise our stake.
Thank you.
Meaning, in this pandemic, telling the public that our selection of the vaccine science-based.
The Department of Foreign Affairs also assured there was no strings attached in the vaccine deal with China. Meanwhile, another issue tackled at today's Senate hearing about the government's vaccination plan was about the emergency use authorization of COVID-19 vaccines that will be donated to the country. The Food and Drug Administration once again clarified that donated vaccines cannot be used without their approval. Mirasola Bogadil will tell us why.
The brand or manufacturer will not be a basis for granting emergency use authorization to COVID-19 vaccines that will be donated to the country, according to the Food and Drug Administration. During the continuation of the Senate hearing regarding the vaccination plan of the government earlier today, FDA Director General Undersecretary Eric Domingo said that if the vaccine donated has not been granted an EUA in the Philippines yet, they will be given approval per batch. Meaning that if China donated 500,000 doses of Sinovac vaccine to the Philippines in February and it was given an EUA, it does not mean that the EUA will be valid for their future donations.
Halimbawa, nag-donate kayo ng 50,000 doses, no? Tapos pinahiningan po ito ng registration ng DOH, tas dinran po ng authorization ng FDA. Ang binibigay po namin authorization for those 50,000 doses lamang, not for the product in general. Lagi po yun, per particular batch, kung ilang volume, yun lang po ang pinapayagan.
But if the manufacturer, like Pfizer, has already secured an EUA for their product, there will be no need for the Department of Health to apply for an EUA for the donations they will receive. The FDA also clarified that COVID-19 vaccines that already secured an EUA in their home countries or the World Health Organization will not automatically be adopted or used in the Philippines. Yusek Domingo said that this will only help in expediting the process of their assessment because of the existing information about the vaccines.
So ang dagdag lang po na hinihingi natin na requirements, number one, may country-specific po sila. Na risk management plan, kailangan po yung may stability study sila. Pag dinala galing Kalamazoo o Belgium at dumating dito, stable pa rin siya. Pagkatapos po yung Asian data, hindi natin pinapahiwa. Kasi sa US po, syempre tinignan nila pang kalahatan. So we just ask for a little more details. We give our own EUA.
The issue about the EUA of donated vaccines was raised when Senator Francis Tolentino said that it is possible for some local government units to receive vaccine donations from their sister cities in other countries or non-profit organizations. But Senator Nancy Binay said that this is not possible yet, for only the national governments are allowed to buy vaccines from manufacturers. Mirasol Abugadil, UNTV, News and Rescue. We serve the people, we give glory to God.
Vaccine czar Secretary Carlito Galvez warns that the delivery of China's Sinovac COVID-19 vaccine, which is scheduled to arrive in the country next month, could be delayed for certain reasons. Rosalie Cos will tell us why.
2 vaccines are expected to arrive in the country in February. One is manufactured by American pharmaceutical company Pfizer through the COVAX facility, as well as the 50,000 doses of the China's Sinovac vaccine supposedly to be delivered on February 20. But according to vaccine czar Carlito Galvez, if China's vaccine will not be able to secure an emergency use authorization from the local Food and Drug Administration, the delivery may be delayed.
Kung meron po tayong delivery na February 20, it will be delayed until such time that the FDA approval has been cleared.
Sinovac has submitted its EUA application before the FDA last January 14. However, the vaccine experts panel together with the FDA have to review thoroughly the date on Sinovac's vaccine's trials since it has not secured an EUA from stringent regulatory authorities unlike the Pfizer vaccine.
Problema po natin sa Sinovac at yung ibang mga aplikante natin, wala pa po silang EUA galing sa mga stringent regulatory authority katulad po ng America, US FDA or UK na nasala na sila usually at may question and answer na pong binibigay sa amin. So ito po parang first, talagang parang tayo pa lang ang nakakakita. So binibigyan ko po talaga sila muna ng 1 week to take a look at the data and then we will meet and then collate all of the questions and clarifications that we want to ask the proponent.
The vaccine czar reiterated that the government will only procure COVID-19 vaccines approved by the vaccine expert panel. Rosalie Cos, UNTV, News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Philippines may be granted fewer COVID-19 vaccines through the COVAX facility. Aiko Miguel will tell us why live. Yes, Aiko, good evening.
Yes, William, good evening. Health Undersecretary Maria Rosario Vergere assures that coronavirus vaccines will reach Filipinos. This despite the tough competition of supply among rich countries. The COVAX facility also advised that they will have to cut down their supply tranches in countries. Undersecretary Vergere adds, though there would be less supply from the COVAX facility, 148 million doses of COVID-19 vaccines will be procured by the government will still be enough for Filipinos. Here is Undersecretary Maria Rosario Vergere, the spokesperson of the Department of Health.
So sabi nila, if ever, baka mangyari, mas less of the 20% ang maibigay. And when we had our meeting etong parang first week of January, they said na mukhang 15 to 16% na lang instead of the 20% ang maibibigay sa bawat bansa. And dun sa 15 to 16%, yung mga mauunang doses na ibibigay would be about 3% muna ng population or less. So it's going to be in tranches, kumbaga. But I doubt it, no, na hindi makaka-deliver ang COVAX.
William, the DOH clarifies WHO will be supplying vaccines from the COVAX facility are free, but the country can also procure in cheaper prices.
Kung kami ay interesado pa rin na bumili through COVAX, kasi mababa yung mga presyo nila, negotiated na yan around the globe. Kung interesado pa rin ang Pilipinas na bumili sa COVAX, doon tayo maglalabas ng pera. That is over and beyond or above the 20% that they will give to us free. So wala po tayong nilabas na pera sa COVAX.
William, around 30 million COVID-19 vaccines from the COVAX facility are expected to be delivered in the country by first quarter of the year. COVAX is a global initiative led by the World Health Organization with the Vaccine Alliance Gov't and the Coalition for Epidemic Preparedness Innovations that aims to ensure equitable access to coronavirus vaccines. And that is the latest live. Back to you, William.
Thank you. Aiko Miguel reporting live.
The Department of the Interior and Local Government, or DILG, has urged local government units to prepare a local vaccination plan that contains the preparation of risk communication plans and conduct of early vaccine communication campaign to disseminate critical information on COVID-19 on the COVID-19 vaccination program. In a statement issued on Thursday, the DILG spokesperson Undersecretary Jonathan Malaya said LGUs should craft the vaccination plan as provided in Department of Health's guidelines on the national vaccination program, and to prepare this in coordination with the respective DOH Centers for Health Development. They must also coordinate with the Philippine National Police and the Bureau of Fire Prevention for logistical assistance. The said plan must also include a master list of priority eligible vaccinee population, identification of possible vaccine centers, available cold chain storages, and other logistical requirements, and a master list of existing human resources and personnel needed in the vaccination program. LGUs seeking authorization for emergency use for the purchase of COVID-19 vaccine must also coordinate with their provincial governments to ensure that there is enough vaccine supply for everyone. U.S. President Joe Biden began his first full day confronting a host of major crises facing his administration, starting with the raging COVID-19 pandemic. Biden unveils a national strategy to combat the virus, but cautioned that it would get worse before it gets better. Michael Ray De Leon reports why.
In his first full day in office, President Joe Biden has moved to coordinate federal efforts against the coronavirus pandemic, such as laying out plans to boost testing, vaccinations, and masks by signing a series of orders and directives.
Our plan starts with mounting an aggressive, safe, and effective vaccination campaign to meet our goal of administering 100 million shots in our first 100 days in office. We're on day one.
Biden has criticized so far the vaccine rollout in the United States, calling it a dismissal failure. Likewise, Biden asked Americans to wear a mask over the next 99 days to stop the spread of the virus. Biden is also working with Congress for another relief package that would include direct payments to eligible Americans, support for small businesses, and funding to fight the virus. Meanwhile, Dr. Anthony Fauci, who served under Trump but has been promoted to Biden's chief medical advisor, was at Biden's side during the event and then spoke to reporters in the White House briefing room for the first time in weeks after Trump largely banished him from the podium. Fauci said he was uncomfortable at times during the Trump administration. He did not mention the Republican former president by name, but referred to comments about the drug hydroxychloroquine, which Trump boasted as the treatment for COVID-19 before its efficacy had been proven, which Fauci said were not based on scientific fact.
The new things in this administration is if you don't know the answer, don't guess. Just say you don't know the answer.
According to the data of Centers for Disease Control and Prevention, there is now over 24.6 million cases of COVID-19, with a total of 409.6 thousand deaths in the United States. Biden declared to the nation that with these actions, Americans will receive the help that they need.
We will defeat this pandemic. And to a nation waiting for action, let me be the clearest on this point. Help is on the way.
Miguel Rey De Leon, UNTV News and Rescue, USA. We serve the people, we give glory to God.
For those watching us on YouTube, please click the subscribe button you see on the right side of your screen and ring the bell for notification. You may also follow us on Facebook.
The government's task force on COVID-19 response has approved the recommendation of the Health Department to impose stricter testing protocols for arriving travelers from countries with cases of new COVID-19 variants. Rosalie Cos will tell us why.
The Interagency Task Force has ruled that inbound passengers from countries with new COVID-19 variants must be tested upon arrival in the country and undergo another test 5 days into their quarantine. If their second RT-PCR test yields a negative result, they can be sent home. Health spokesperson Maria Rosario Vergere said the passengers will be turned over to their respective hometowns after their negative result.
Kapag nag-negative po sila po ay pinapayagang bumalik sa kanilang local government but with the condition that the local governments will monitor them to continue their 14-day quarantine in their local governments.
Previously, the IATF mandated incoming travelers to undergo quarantine at a facility for 14 days regardless of the test results upon arrival in the country. Meanwhile, the IATF is now allowing the entry of foreign nationals with valid visas and spouses and children of Filipino citizens traveling with them to enter the country despite restrictions. Filipinos arriving for highly exceptional or medical reasons and local diplomats shall likewise undergo quarantine protocols set by the DOH. The country's travel restriction, which will last until January 31, covers travelers from 35 countries. Rosalie Cos, UNTV, News and Rescue. We serve the people, we give glory to God.
Meanwhile, the patient who was reported as the Philippines' first case of the B117 SARS-CoV-2 variant, otherwise known as the United Kingdom variant, has already tested negative for the virus. But despite this, the patient will still remain at the quarantine facility. Aiko Miguel will tell us why.
The Philippines' first known case of the UK COVID-19 variant is now negative of COVID-19, but is still undergoing final assessment from doctors in a quarantine facility in Quezon City. According to Dr. Rolly Cruz from the Quezon City Epidemiology and Disease Surveillance Unit, once he is totally cleared of the virus, then he will be allowed to return home. The LGU will strictly monitor his condition for 2 weeks. According to the Department of Health, a thorough assessment such as chest X-ray needs to be done because the patient was previously diagnosed with pneumonia. Meanwhile, the release of results from genome sequencing of the 6 close contacts has been postponed after the center's machine encountered a technical problem. Results pending are from the samples of his 3 co-passengers, his girlfriend and mother, and the healthcare worker who assisted the index case in the facility.
Just yesterday, they called us and there was something wrong with the machine that they were using. So they had to stop the process. They committed na baka Sabado po lumabas ang sequencing natin.
Meanwhile, DOH is seeking the help of the National Bureau of Investigation to contact the patient's 2 co-passengers during their flight from Dubai to Manila on January 7. Of the 159 passengers on board the Emirates flight, 13 travelers, including the index case, tested positive for COVID-19. At least 14 contacts of the patient have contracted the disease. Aiko Miguel, UNTV, News and Rescue. We serve the people, we give glory to God.
The Interagency Task Force for the Management of Emerging Infectious Diseases eased the age restrictions in areas under modified general community quarantine. Rosalie Cos will tell us why.
Children aged 10 to 14 years old can now go outside of their homes beginning February, so long as they are in areas placed under modified general community quarantine. Presidential spokesperson Harry Roque, the Interagency Task Force for the Management of Emerging Infectious Diseases, has agreed to lower the age restriction following a meeting on Thursday. Prior to the latest IATF decision, the government exempted persons aged 15 to 65 from the strict stay-at-home policy but compelled the observance of health protocols during the community quarantine.
Pwede na pong lumabas ang mga bata na may edad 10 taong gulang hanggang yung mga senior citizens na hanggang 65 years old.
Roque said individuals below 10 years old and over 65 years of age are still required to remain in their residence at all times. Local government units are given authority to decide on the age limit for minors depending on their coronavirus situation.
Yung mga lokal na pamahalaan naman po sa mga lugar na GCQ or General Community Quarantine, hinihikayat po natin na sana po payagan na rin lumabas yung 10 to 65. Pero uulitin ko po, decision pa rin po yan ng mga lokal na pamahalaan.
On Tuesday, Trade Secretary Ramon Lopez said he would ask the IATF-EID to let children as young as 10 years old leave their residences to help spur the economic activities in the country amid the COVID-19 pandemic. Despite the easing of the lockdown a few months ago, the trade chief admitted that the recovery of businesses has been restrained due to the limited population allowed to go out, shop, and dine. Lopez remained optimistic that the government's forthcoming rollout of the coronavirus vaccines will also boost consumer confidence and provide a safe environment in the country. Rosa Licoz, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the University of the Philippines Octa Research Group expressed concern over the government's decision to ease quarantine restrictions in MGCQ areas starting February. Aiko Miguel will tell us why.
The UP Octa research team rejects the government's decision to expand the age group who are allowed to go outside of their homes during community quarantine. Under the new rules, children aged 10 to 14 years old are allowed to go out beginning February 1. According to Professor Ranjit Rai, the government has to rethink their decision, especially that there is a threat of a new COVID-19 UK variant.
There is the great possibility, although evidence is still being collected, that the new and more contagious UK variant is already in our communities. Why will you change policy in such a drastic way, expose vulnerable groups to a more contagious, possibly more contagious variant? Okay, that will only increase new cases and possibly increase mortality. This is against all sensible epidemic management that exists around the world.
In the government's defense, the Department of Health says they have a concrete basis why the policy is approved.
Ang rationale was we balance the economy with health. As long as we continue to implement and comply with the minimum public health standards, kahit naman anong age siyang lumalabas, as long as compliant tayo, we are protected and we are assured na yung infection risk would be very low.
According to the DOH, to assure that there will be no COVID-19 case surge, though age restrictions will be eased, they will be working hand in hand with the local government units in strictly implementing health protocols in the country. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippines' COVID-19 tally climbed to 509,887 after 2,178 new infections were confirmed by the Department of Health today. According to the updated case bulletin, Quezon City logged the highest number of new cases with 148, followed by Bulacan with 88, Cebu City with 80, Davao City with 79, and Mountain Province with 75. The DOH also reported 250 more survivors, bringing the recovery total to 467,720, while the country's death toll rose to 10,136 with 20 new fatalities. There are also 32,031 active cases or patients undergoing treatment or quarantine. Protesters from various progressive groups gathered at Mendiola in Manila today to mark the 34th anniversary of the Mendiola massacre. Dante Amento reports.
The COVID-19 pandemic did not hinder some activist groups to flock at the Mendiola, Manila early this morning. This is in connection with the 34th anniversary of Mendiola massacre, where once again they asked the government for free land, particularly for the farmers. They also wanted justice for the peasant organizers or farmers who were killed due to allegedly military or police abuse.
It's really high time to discuss and pass measures to respond to the demand for continued cash assistance and free land distribution and sustained support for farmers.
The protesters appealed to junk the anti-terrorism law, which is allegedly being used to silence the critics of the government. Meanwhile, the Kabataan Party List believes that the termination of UP and DND Accord is also the beginning of more human rights abuse by the state forces.
Bakit kailangan pa itong tanggalin, di ba? Walang batayan, at walang dahilan, kundi ang nakikita natin ay yung suppression talaga dun sa critical na action ngayon ng mga estudyante, kabataan.
Dantiamento UNTV, News and Rescue. We serve the people. We give glory to God.
For those of you watching us on YouTube, please click the subscribe button you see on the right side of your screen and ring the bell for notification. You may also follow us on Facebook.
Manila City has started its simulation of the vaccination rollout for its residents. Part of the vaccination plan is registration, but the city mayor sees a huge challenge. Nonetheless, Mayor Isko Moreno Dumagoso says he is ready for COVID-19 shots. Here's why from Nina Armilio.
The Manila City LGU is among the local governments that have begun preparing for the vaccination of their constituents against COVID-19. But City Mayor Isko Moreno Dumagoso sees a huge challenge: poor internet connectivity. The Manila City's vaccination program requires online registration via ManilaCovid19Vaccine.com, and this requires internet connection. The target time per individual is just 6 minutes, but without stable internet connection, the process will take longer than expected.
Ang logic is saan kami magkakamali. O temo Kuya Daniel, alam mo una kagad, pagbukas sa pagbukas, alam mo una kagad problema. Internet. Bumagsak ang internet. O, kita ninyo yan, ha? Ayan, iisipin ba natin na kailangan matibay yung internet?
Mayor Moreno points out that every minute counts for policymakers to ensure that 70% of Manila City's population would be vaccinated and that the vaccines would not expire. There's also a foreseen influx of residents who failed to register online. The Manila City Chief Executive underscores the importance of sufficient vaccination centers and medical workers involved in the vaccination rollout.
Anong logic doon? Okay. Sa 1,000 tao, ilang oras tayo? That's the yung mga anong tawag diyan na conclusion. So, kung matagal yung 1,000, sa 500 tao, ilan tayo? Okay. Pagpalagay naman natin, let's just say for the sake of conversation kay Daniel, 500. O teka, ilan ba ang goal natin? 1 million. Ilan ba nasa bodega natin? 100,000. Kailan ba mag-i-expire yan? From there, makukwenta na namin.
For one, Mayor Isko says he is ready to get vaccinated to serve as an example, remove the doubts, and increase the confidence of Manileños in the government's vaccination program, especially those who fear getting inoculated because of the Dengvaxia issue. Mayor Isko assures that only the vaccines approved by the country's regulatory board will be used on Manileños.
Kahit anong brand yan, basta kung itong mga itinalaga ng Estado sa kanilang posisyon, lalo na sa regulatory agency, will affix their signature, no? Na merong ligtas na bakuna, sinertipikahan nila, we will continue to believe in our system. And we, as people, must continue to believe.
Manila City already has freezers prepared for the vaccines. The storage facilities will be completed before the vaccine doses arrive, according to Mayor Dumagoso. Simulations will continue to ensure that everyone that will participate in the vaccination rollout is prepared for the actual administration of the vaccine. Nina Armilio, UNTV News and Rescue. We serve the people. We give glory to God.
The local distributor of China's state-owned Sinopharm vaccine has denied allegations of vaccine smuggling in the Philippines. This was after Senator Risa Hontiveros asked about the alleged inoculation of the vaccines to some members of the Presidential Security Group and cabinet members. MKG Universal Drugs Trading Corporation President and Chief Executive Officer Attorney Mark Christopher Tolentino said they have yet to import and distribute its COVID-19 vaccines to the Philippines. He added that they had just completed its requirements in regulatory agencies, including its license to operate from the Food and Drug Administration. The distribution company claims it has no knowledge as to where the vaccine supply came from. It was President Duterte himself who revealed last year that a number of Filipinos have already received the Sinopharm vaccine.
We categorically deny all the allegations because in the very first place, based on our record, we never import or distribute Sinopharm anti-vaccine to the Philippines yet as of present.
Meanwhile, a labor group explained that the current 537 pesos minimum wage is no longer appropriate for workers in Metro Manila. The Labor Department acknowledges the clamor for wage hike, but considers other criteria. Asher Kadapan Jr. will give us the detail live. Yes, Asher, good evening.
Will, good evening. Labor Group Defend Jobs Philippines once again calls for wage hike in the country. According to Christian Lloyd Magsoy, the group's spokesperson, the 537 peso minimum wage in the National Capital Region he cited has not been suitable to a regular Filipino family even before the pandemic. And as prices of basic commodities and services soar, they asked the government to impose a substantial wage increase for workers across the country.
So hindi ang akma, hindi angkop, kulang na kulang yung minimum wage na meron ngayon. So ikukumpara mo sa dapat nagigastusin ng isang pamilya. Ito ay panahon pa nung walang pandemya, lalo pa ngayon na matinding yun nga, nagtataasan yung mga bilihin, walang trabaho yung mga manggagawa, walang ayuda.
The labor groups has been petitioning for a 750 peso national minimum wage. According to the Department of Labor and Employment, the petition has already been filed in the Congress, but hearings are still ongoing. Dole also said they consider the clamor of the workers for wage increase as they are aware of the situation. But the agency has to also study the other criteria before coming to a decision. The Labor Department explains that they should also weigh the employer's capacity for the wage hike, as enterprises have also been severely affected by the pandemic. And the price increase in basic commodities is more of a supply issue and only in parts one of the several factors in considering an increase in the minimum wage.
Kinokonsidera ang concern na yan, hinaing ng ating mga manggagawa. And at the same time, we have to analyze that in relation to its impact on the growth of the economy and whether the employers are capable of absorbing such costs.
Well, the Labor Department has also emphasized the need to secure jobs and recover enterprises that the wage increase, or more than the wage increase, now more than ever. Will?
Yes, thank you. Asher Kadapan Jr. reporting live. And for the news abroad, here's Maria Latosa reporting live from Perth, Australia.
Good evening, William. U.S. President Joe Biden will be seeking a 5-year extension to the New START arms control treaty with Russia. The arms control treaty, which is due to expire on February 5, limits the United States and Russia to deploying no more than 1,550 strategic nuclear warheads each. Here is White House Press Secretary Jen Psaki said in a recent press briefing.
The president has long been clear that the New START treaty is in the national security interests of the United States, and this extension makes even more sense when the relationship with Russia is adversarial, as it is at this time.
The New START treaty also limits the land and submarine-based missiles and bombers that delivers them. In a statement, the Pentagon spokesman John Kirby said that Americans were much safer with the treaty intact and extended. Kirby also stated that the department will remain clear-eyed about the challenges that Russia poses and is committed to defending the country against adversarial actions. Meanwhile, health experts are advocating the need for physical activity, especially for adults who are working at home. But did you know that even if you exercise every day, you might not be getting as much physical activity as you think you are? Early Briones will tell us why live. Yes, Early, good evening.
Mariel, good evening. It is advised by the World Health Organization or WHO that healthy adults aged 18 to 64 years old are recommended to spend 150 to 300 minutes of aerobic activity per week, and the intensity for this activity should be from moderate to vigorous. Research showcases that 36% of individuals overestimate their levels of physical activity, and 61% who do not reach their required levels also overestimating. One of the reasons people tend to overestimate their physical activity levels is because they don't understand what is meant by moderate and vigorous intensity exercise. Moderate intensity exercise is considered to be any physical activity that requires a person to work at 40 to 59% of their heart rate reserve. Anything higher than 60% of your heart rate reserve is considered vigorous exercise. Every person's heart rate can be different at the same exercise intensity, affected by age. Increased use of your heart muscle will also lead to better cardiovascular fitness, which can help reduce risk of premature death or cardiovascular disease and heart attacks. While WHO's recommendations exist to help people keep fit and stay healthy, it's up to each person to choose what activities are best for them. And as you exercise more, be sure to monitor your progress by being mindful of how the exercise feels. Marielle?
Thank you, Early, for that live report. And those are the reasons behind the news in other parts of the globe. Back to you, William.
Thank you, Mariela Toza, reporting live from Perth, Australia.
And those are the reasons behind the news, January 22, 2021. I am Hardin Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
Because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.